Hi, welcome back everybody. This is Dr. John Hayes. You're listening to Beating Neuropathy and Chronic Pain, heard right here Sundays, 7:30 p.m. on 95.9 WATD. Before we cut to the break, this last time we were talking about chronic pain in particular. We're talking about somatic pain. And right before we went to break, I spoke about how somatic pain, fortunately, is relatively easy to treat. For example, if you've suffered a laceration, which is a cut, and it's been sutured and it heals, fortunately, in most of us, the pain disappears. There are, of course, cases where it doesn't, and that would, of course, usually involve more extensive injuries or more extensive wounds. God forbid you have an infection after a wound or a laceration. You know that can really perpetuate pain and it can last a long time. But in general, and I know I'm making a generalization here, but somatic pain, which is pain that results from excess stimulation of the sensory nerves, or what we call the nociceptors in the skin and the soft tissues, is really relatively straightforward to treat. You know, in the clinic we treat it with things like manipulation, manual therapy. You know, drugs, of course, early on can be very, very helpful in helping to manage pain, but they're usually not needed long term in many forms of somatic pain. If they are, you know, you're dealing with a more significant condition such as an inflammatory arthritis or diseases like lupus and collagen diseases that affect the soft tissues and so on. But basically, you know, we did say, and I do want to reiterate that somatic pain is very common. It's something that you know, every human being experiences. And one of the points we made very early on in today's show is that the sooner and the better you can treat an acute health issue, the less chance you have of the situation becoming chronic. And you're going to see that as we go through some of these other types of pains too. You know, one of the most common things that we of course see in any physical medicine clinic or the neuropathy clinics, for that matter, is chronic back pain. And one of the biggest reasons for patients developing chronic back pain is not taking care of the acute episodes or having multiple acute episodes that are just strung together without any significant intervention. And that really can lead to a whole host of problems. And again, my point in being redundant is to make sure that we do emphasize how important it is that when you do have these underlying health issues, that they do get taken care of, that you do work with a professional with you're very comfortable, in whom you're confident that the appropriate diagnostic workup has been done and that everything possible is being done for you. That is the best prevention that we do have for chronic pain. But moving on a little bit, what I'd like to talk about next is what's called visceral pain. Visceral pain is perceived similar to somatic pain, but can be a little bit harder to pinpoint. And let's talk about, you know, what some of these visceral forms of pain may be. One of the examples that I like to use, because it's something that we actually see several times a year in our clinic, is when a patient has gallbladder disease. One of the common presenting signs of a gallbladder symptoms is not always abdominal pain, but it's pain felt in the upper back. Likewise, when patients have issues with the pancreas, which is an organ of digestion, unfortunately, things such as pancreatic cancer can manifest as pain felt in the spine. The pain can be very, very intense. It can be very, very localized, you know, to the soma or the body. And even though the pain is coming from something that's wrong with an internal organ, it really can be representative of a much more serious condition. And I'm reminded of this because you know, several times in the last year in our own clinic, we've had patients with chronic back pain whom we co-manage with other health professionals. And you know, as I tell patients all the time, I want to know what you don't have. So in patients who have persistent pain, we want to make sure that if things such as gallbladder disease, heart disease, diseases of the pancreas and other internal organs haven't been ruled out, that they do be ruled out. So the point is that even though you may be feeling pain in your soma or your skeletal system, does not necessarily mean that the pain is necessarily originating in that area. I think everybody's you know, very familiar with the classic symptoms of a heart attack or a heart disease. Can involve chest and arm pain, but not always. You know, some patients don't have any of those symptoms at all. Some patients have no symptoms, believe it or not. Some patients simply get nauseous, and some patients just look ill. I'll never forget, I had a patient about 15 years ago walk into my clinic who literally was having a heart attack, a very stoic gentleman who was actually in the throes of a heart attack, but he was just so stoic that I believe his brain actually shut down what was going on. And the problem with that is that this gentleman ended up with permanent heart damage because he consciously dumbed down, if you will, the symptoms that he was experiencing, such as chest and arm pain, and actually minimized them. So again, you know, the word of caution is if you're experiencing anything unusual, especially if it's a sudden onset with no explanation, you owe it to yourself and owe it to your family to call 911 and find out what is going on. Now, some of the other examples of visceral pain that we do want to talk about are things that accompany things that, or areas of the body that we're all commonly familiar with. You know, people that suffer from recurrent urinary tract infection can have pain in the lower back, very, very commonly. In fact, one of the things that we screen for in the clinic are smoldering urinary tract infections because, as we said earlier, not only can they cause inflammation, which produces chronic pain, but they can also, of course, cause low back pain. Another situation we see, of course, is in males who have prostate disease. This, unfortunately, can manifest as back pain. In very advanced prostate disease, such as prostate cancer, unfortunately, one of the first signs can be back pain. So those are the things that we have to look at. The other types of common sources of visceral pain would be things like irritable bowel syndrome. You know, irritable bowel syndrome, or IBS, is very, very common. It accompanies fibromyalgia and interstitial cystitis, which are two other conditions which we'll spend quite a bit of time on in the future talking about. But one of the biggest issues, of course, with IBS is that it can masquerade as more serious illnesses, or, as we've spoken about before, and as my professors have taught me for years, patients are entitled to have as many diseases simultaneously as they would like, or as Mother Nature would give them. The bottom line is that we, as clinicians, have to be ever vigilant in terms of what's actually going on and what's actually creating the patient's pain issue. So all of these things are, you know, have to be taken into consideration, and this, of course, does emphasize the need again for, you know, getting yourself in the hands of a good healthcare professional, because it does make a tremendous difference. You know, moving forward and in your recovery. And again, one of the best things that you can do for yourself and your family to minimize chronic pain is to treat the acute pain early on wherever possible. One of the things I'd like to start to talk about tonight, and I know we're going to have to pick it up in next week's show, but we do want to talk about this whole issue of what's called psychogenic pain, or pain that accompanies stress. I think is probably a real good word. There are also, of course, periods in our life when we undergo extreme stress, and this leads to pain. And when we come back next week, what we're going to talk about is, you know, some of the most common experiences that we have as human beings, or you may observe in a family member, but then again, more importantly, what you can do about it. And what I'd like to remind everybody that you can do is, if you have any questions regarding the material that we present here weekly, if you have suggestions for shows or guests, send us an email to neuropathydoctor@gmail.com. You can also learn a lot more about what we do in our clinics, both locally and nationally, for your family and friends by going to neuropathydr.com. That website is updated every week. There's a wealth of information there, and I think you'll find it very, very helpful. But again, your questions are welcome. I hope you're finding the content of the show is very, very beneficial. As the weeks and months go by, again, we hope to expand upon the concepts that we've presented here, and then also, of course, introduce other guests like we've had in the previous couple of weeks, Russ McCann, of course, and last week, Laura Amaral, the last 2 weeks, in fact. So once again, it's a pleasure to be with you. Be sure you stay tuned for my good friend Dr. Mark Mincola, who follows me every night. Again, you're listening to Dr. John Hayes, Beating Neuropathy and Chronic Pain, right here on 95.9 WATD.